My name is Alexander Zharkov. I'm a volunteer from the start of the war in Ukraine. I am a citizen of Ukraine, so I help the people with medicine, with evacuation. Tell me please, who you are.
Hi Alex, thank you for your service during the war to the people. My name is Doctor Rajiv Fernando. I'm a disaster medicine specialist and infectious disease specialist. When the war started on the 24th of February, immediately I realized there was something that I had to do over here. On the 28th I was here, came to the Poland-Ukraine border, and I was asked to work in the refugee clinics because at that time thousands of people were crossing the border and I was working there. My roles during the war have shifted on and off. So besides volunteering with refugees, we ended up supplying medical supplies, medicines, medical supplies to various hospitals across the country, including the Ministry of Defense hospital as well. Other than that, over the weekends when I have a day off, we go around the country distributing dog food because we know there are a lot of animals that are homeless as well.
Tell me please, do you have a scared when you come to Ukraine in war?
Absolutely not. It is the right thing to do. When I heard about this, I came in with my heart and courage. The only protection I had was my heart, nothing else. I came to help.
Tell me please, what exactly your strategy or your plan for doing here on the long time process in Ukraine, because we don't know when our war will end.
Thank you, Alex. And we do know that after Crimea was annexed, there was a lot of refugees with post-traumatic stress syndrome at that time. So this has been going on for years. My strategy and our charity, Chiraj, our strategy is to come here, establish psychology clinics. And we plan to go on as long as it takes. We want to stay here to help the people. We do know our focus really is going to be people in the military, soldiers who are wounded with post-traumatic stress syndrome. What's unfortunate, Alex, is people, when they have physical injuries, it's very obvious. But what's not obvious is the psychological problem. So it really requires specialists to really look deep and be vigilant that someone could be having a psychological problem. Because doctors always, they see an injury, they go to the injury, but they forget about one's mental status. So mental health is just as important as physical health, and that's why we're here, to stay as long as it takes.
But it's a long term process, or maybe you want to look at a real version of this center. How it's included?
Well, Alex, our goal is a long-term facility. We do understand that things change along the way. I learn along the way. We all learn along that way, and we are willing to make changes to accommodate what we're seeing on the ground. But our goal is long-term. We don't want to be here for 6 months. We don't want to be here for a year. The most important thing for us is to work with Ukrainian psychologists. We want to hire Ukrainian psychologists who know the language. We want to stimulate the local economy and keep our psychologists here. In addition to that, we are hiring international psychologists from the United States, Australia, Portugal, to come here and work together. So we want to learn from the Ukrainian psychologists and the other way about as well. So we can teach some of our approaches. The most important thing is we want to have state-of-the-art treatment. And this really is just beyond an office space. It's psychoeducation, psychological first aid, community outreach programs. We want to have a hotline where sometimes people don't want to come to the clinic. And we want to call it a community health center because we do know in Ukraine there's a big stigma about seeing a psychiatrist. So we want to keep it a community center. And Chiraj is very focused on this. We want to make sure, even in the middle of the night, we want to have a hotline. So if people need someone to talk to, Chiraj will be there. We'll take the calls, we'll talk to them. We want to make this a long-term project, and we're honored to be here.
Can you please tell me what exactly strategy of opening centers in other regions, or it's only in Kyiv?
Yeah, Alex, that's a great question. So we are starting in Kyiv. That's going to be our central operations. But we really want to go to the east. So we want to go as further east as possible because these are the soldiers who are in conflict, they're facing these day-to-day challenges. We will defer to the Ukrainian Ministry of Defense and maintain vigilant situational awareness. So when they tell us it's a good idea to open, we will follow them. That's why we're so happy to be working with the Ministry of Defense, and they will guide our decisions, and we want to make sure we do everything for every Ukrainian on the front line.
Okay, and approximately clue, what your impressions for this work? It's 1,000 people or just how much you want to help?
Yeah, that's a great question. And so our immediate goal is to focus on the obvious people who are going through PTSD, anxiety, and depression. So like we've mentioned before, the soldiers who are on the front line. But what we haven't spoken about, and equally important to my heart, is focusing on gender-based violence. I was in Bucha at the time, and we were seeing these cases that were referred out, just horrific stories. And that's another area of focus. Chirag is always focused on women and children, and that's another thing we want to do. So we want to focus on the high-risk cases. Of course, in a perfect world, we'd like to open up doors to everyone, bring everyone in. Our first focus, Alex, is really to focus on these two populations, and then absolutely, sky's the limit. If we get appropriate funding, we will definitely open our doors to any Ukrainian citizen who needs help.
It's good clue, and I hope that it will be enough for future to start. I think that it's a good idea, and I hope that we will for sure make this happen.
Thank you, Alex. Chirag and my team is very excited to work with the Ministry of Defense on this project. We will save thousands of Ukrainian lives. Thank you for having us here.
What is difference with work with civilian people and with military people for PTSD?
Yeah, that'll be a different program in the sense we'll focus on PTSD. That is specific. So we have some of our psychologists from around the world. They focus on conflict associated with PTSD. That is one area of focus. The other area of focus is people, civilians who are facing it, but they will be different protocols, Alex, for different situations. So different psychologists with different experiences for PTSD with conflict, PTSD associated with rape, and then civilians. So psychology is such a broad field, but we want to make sure that we focus on every area independently.
The main questions which interest to idea from your side, that a lot of mothers send sons and husbands to the front line, and they back and they have some kind of problems with PTSD, and these persons do not understand how to win life or future. Yeah. So that's why maybe you have any kind of ideas or any kind of clues, and you show some kind of little tricks how to do with these people in the future for professionals in social area. Maybe some short teasers how to do these people.
So that's a great question, Alex. And we do know that people who are suffering, like I mentioned before, when you treat the person with PTSD or the soldier with PTSD, you're really treating the patient. Oh, sorry, one more time. Sorry. That's a great question, Alex. So when you treat an individual for PTSD, you're really helping the rest of the family, and you're also helping the community, because this goes all over the community. So it's very important to know that. We hear some of the examples where people with PTSD, they don't react, they don't talk, they don't move, So everything has to be very specific, and we at Chirag, we're committed to bringing the latest technology over here, psychometrics, psychoanalysis, and we are really bringing down the best over here. So we'll be, like I mentioned, I'm currently scanning the whole world to bring the best psychologists and the best therapies. So they specialize in this kind of thing, and we're confident it's going to take a long time. Nothing happens overnight. This is a long process. And like I mentioned, Chirag is here. We're focused for the long run. So the most difficult thing in the world is when a mother sends her child, her son, to fight in a war, and they don't know where the mothers don't know what's going to happen to these sons. Are they going to come home? They're worried. These sons are away for days and days and days. are they alive? Like, are they in bomb shelters? What is going on? Many people don't hear. So we really want to address this as well with the mothers. We want to talk to them. We want to send our psychologists to them. That's my eventual plan. Some people who can't come, we will go to them. We will bring medication. But we're very ambitious, Alex, with this plan. And this is a conflict-associated PTSD. It's just not the soldiers. It's also the families that go through this. So we want to establish, like we mentioned before, we want to have phone hotlines. And for people who can't come to the clinic, we'll either send transportation or we will go there and we will make sure the health of Ukrainian mothers is very important.
Too many people have some kind of scares for, it's like a main of mentality of Ukrainians. They do not want to go to the psychologist and open heart for his problems. Maybe you have an idea or a clue what must do these persons to make solve his problems, their problems.
Yeah, Alex, that's a great question. And a few years ago, the United States was also facing this problem. You know, it was a big stigma. Nobody wanted to talk about it. But as stressors go on, over the last few years, there's much more public awareness. We know that close to 10% of Americans have some sort of psychiatric illness. My hope over here is this is a right time to come forward. This is a war, this is a conflict-associated PTSD or conflict-associated anxiety or depression. This is a great time to come forward. There's nothing to be embarrassed about. Like I said, you know, people in Ukraine, they go to bed at night wondering whether they'll be alive in the morning. I mean, is there going to be a missile? What's going to happen? No Ukrainian goes to bed at night being 100% sure they will awake in the morning alive. So this is a great opportunity, and once again, like I mentioned, we will be having our community workers, we'll be advertising, we'll be talking on the radio, more television, we'll bring more awareness, and there's nothing to be embarrassed about. This is the real, legitimate psychiatric illness from a war. It's not the fault of any Ukrainian person. This is conflict-associated psychiatry, and we really hope we will make our patients comfortable. We will go to their houses, like we said, we will talk to them, we'll have advertising, and we will treat them in whatever way, whether it's through the phone or coming to the office, we will treat them in any way. This is nothing to be embarrassed about. These are real problems associated with the war.
Final stage, tell final words to all Ukrainians for this camera.
My name is Dr. Rajiv Fernando from New York. I'm so honored to be here with all of you during this war. I came here, I didn't care about my life. I really want to be here. Thank you for embracing me and making me feel at home. Ukraine is home to me now. Since I'm here and you've taken such good care of me, I want to take good care of you. We want to bring all our services from all over the world to work with your specialists over here, and we will work together. We will win this. We have to stay confident. We will win this. Thank you, all of you.